Hi guys. Um, I thought that your idea for pediatric mental health, that resource app was really interesting. Um, I think that, like you said, I really agree that that is a really big gap in healthcare. I have seen this personally doing rural transition this semester in the ER. Um, a lot of times for us as a rural hospital, these patients who come in are um, doing like telehealth with behavioral health therapists, which can be of benefit emergently, but it doesn't really offer that like kind of personalization, and it doesn't really help with the problem long term. Um, and then, especially in rural areas, it's hard to access providers. And then when think of things like cost and, transportation, distance to travel, those kind of things that can really make a huge gap in, needs being met and availability. Um, And then also another thing that tied into that is, we've really heard in the news a lot within the past year or so of especially teens turning to ChatGPT for kind of that mental health care advice, um, which I know that ChatGPT, who those creators have tried to adjust some of that, but it just kind of highlights, that need, and also that teens really want somebody to talk to that is anonymous, but also kind of personalized to them, I think. um, so my idea for improvement was, I wondered if there was a way to um, kind of integrate some of those DSM-5 scoring tools that we've learned about, to kind of help identify patients who might need extra support or maybe more emergent care, not so much as, um, impinging on their privacy, obviously, but just kind of as a way for maybe like a chat person to come on and like kind of talk to them and prompt them more specifically. And then my question was, um, how you would monitor and address like safety issues like self-harm or harm to others, or just a patient who's, in a crisis that really needs to be addressed. Um, and then my idea for improvement was trying to make it, I don't know how you would do this specifically, but making the interface more like teen friendly. So it kind of aligns more with apps that teens are using to kind of encourage them to be more open and more forthcoming with their feelings, and not necessarily guiding them to a choice, but kind of empowering them to be very like honest um, about how they feel in a safe way, I guess, if that makes sense. Um, but like I said, I think it's a really cool idea that could really benefit a lot of people.